Hi, my name is HadijaHussein, and I am going to present to you my community assessment plan. So basically, the plan will include is the assessment of Cumming, the city of Cumming, Georgia, the health challenges in Cumming, provide the solutions, and also evaluate the success of the plan. Based on the Windshield Survey, Cumming is in Forsyth County, Georgia. It has a lot of green space and new subdivisions for constructions. So it's a growing community. The community is well kept and has safe neighborhood. Services available in the community include grocery stores, recreational facilities, shopping centers, and home improvement stores. Northside is the only major hospital in the community. Social services agencies include United Way, the Place of Foresight Inc., and WIC are available for the underserved population, and they provide shelter, food, clothing for the community. Community assessment of Cumming. So Cumming has a population of over 6,000 members. 18% of the members are below poverty line. 24% of the members in Cumming lack healthcare coverage. So cardiovascular disease is the leading cause of death in the community, and this is due to the lack of insurance and motivation to get preventative care. The nursing diagnosis is increased risk of heart disease among residents in Cumming related to lack of knowledge, busy lifestyle, and lack of health coverage, as evidenced by heart disease as the leading cause of death in Cumming, inadequate health care in some pockets of the community, and safe roads to promote a more active lifestyle. The objective of the plan is to educate the community about heart disease, to encourage active lifestyle, to encourage yearly doctor visits, and provide available health resources to the uninsured populations. The community partners and resources that I was able to collaborate with are Ms. Mary Waddell, who is a case manager at Northside Hospital, Ms. Monique Henry, also a case manager at Grady Hospital. John Cazillo is a clergyman for Christ Culture Center, and Mr. Michael John, a board member for the Place of Foresight Inc. The plan is meeting with Ms. Henry and Ms. Waddell. They provided me with the knowledge and information on how to be eligible for Medicare, Medicaid for the people who don't have insurance, and also provide me with information and contact lists of all the available programs that are in the community and around the Atlanta metro area. I also went and print out some information from cdc.gov about heart disease, listed available physicians in the neighborhood, their numbers and their names. Work with Mr. Cazillo to mobilize volunteers from his church so that we can be able to pass out, give away the flyers. Mr. John, I was able to provide her with the flyers so that he can put that in food boxes when he is giving his clientele's food or some clothing. I also encourage members to bring the flyers at the doctor's visit. The interventions proposed include educating the community about heart disease, conducting mini health fairs in churches. And this includes getting my nurse friends and CNAs to help me in performing blood pressure checks and blood glucose checks for the church members. And if we see somebody who has some high numbers or vital signs that are out above the abnormal, we would give them a list of doctors that we have in the flyer so that they can follow up for appropriate care. There's a study that was performed in an African American community in Milwaukee that proved that implementing health programs in churches has improved its congregation's health status, and this is from Ellis and Mosinski 2018. I would also put all the flyers in elementary school folders and in food packages that are from shelters, so that everybody who has a child in school will be able to get that information when they come back from school. And the food packages for the people who do not have food or they live in shelters, they'll be able to get that information. So that's another way of getting the word out. I can also use Facebook as social media to put that information out so that people will know that there are some mini health fairs that are going on in churches, and also there is more information about heart disease. And we can also plan on creating a walking group to encourage active lifestyle. These groups are going to be in church environment. The proposed evaluation for the plan is I'll go to the doctor's offices and see how many new patients they have acquired based on the information they provide when they establish new patients. So knowing that this patient came based on the information they received from the church or from the flyers will be helpful for me to know who are the people who came to visit the doctor after they heard our session or our information. Also, tracking the performance of the working groups in the churches will be another way of seeing if we're getting any changes in the community as far as living an active lifestyle. So in conclusion, I can say that Kamini is a growing community, and the lack of health coverage in some of the areas of the community and the lack of using physicians for yearly checkups can be some of the reasons why people are having heart disease. So this shows that there's a lack of knowledge about heart disease. So the importance of partnership between healthcare providers and community organizations is very important in getting all the community members to lead a healthy lifestyle and being more knowledgeable about heart disease. So I believe that if we can improve one member in the community, it will be worthwhile to us, as that is one person that can change another person's life and will be leading towards the right direction. And these are some of the references that I've used to pull some of the information for my project. Thank you.